Hello, and welcome to the Secours Community Education Awareness Series on Neuroscience. I am Pat Lane, the Neuroscience Coordinator for St. Mary's Hospital and St. Francis for Secours Richmond. We are pleased to provide this community awareness show on neuroscience and hope that we offer a wide variety of topics over the next few weeks that will pique your neuroscience interest. If there are any questions you would like answered or more information, please make sure you call our Secours number at 804-359-WELL, which is 9355, or check out our website at www.bonsecours.com or contact me at patricia_lane@bc.org. Now, all of this information will be posted on your TV screen throughout the show. Today, I am pleased to host Dr. Sherry Fox and Dr. Peter Alexander. Our topic will focus on brain cancer and the Cullether Brain Tumor Quality of Life Center. Did you know that about every 3 minutes, someone in the United States is diagnosed with a brain tumor, and that brain tumors are the leading cause of cancer death in children? Our expert panel will help us all understand brain tumors a little better today. Our first guest is Dr. Sherry Fox. Dr. Fox is the Vice President of Oncology for Secours Richmond. She is the Program Director of the Cullether Brain Tumor Quality of Life Center. Dr. Fox is a registered nurse who has dedicated much of her career to working with brain tumor patients and their families. She's a graduate of Virginia Commonwealth University School of Nursing, and she has also worked at the University of Virginia. Her work has focused on research and publications related to symptom management and quality of life for brain tumor patients. Dr. Fox is a past president of the American Association of Neuroscience Nurses, and today is actually Dr. Fox's wedding anniversary. So thanks, Dr. Fox, for being with us today. Our next guest is Dr. Peter Alexander. Dr. Alexander is a board-certified neurosurgeon with Neurosurgical Associates. Dr. Alexander graduated from New York University School of Medicine and completed his internship at Baylor College. Dr. Alexander is on staff at the Secours Richmond Health System and is on the Board of Advisors for the Cullether Brain Tumor Quality of Life Center. Welcome, Dr. Alexander.
Thank you for having me.
So callers, we will take questions tonight between 6:30 and 6:45, and the number to call in is 804-915-5202. Now, the mission of the Cullether Center, which is located at St. Mary's Hospital on Bremo Road, is to assist those individuals and their families living with a brain tumor to live a new normal. So, Dr. Fox, can you please explain that philosophy a little bit and share with the community how you got so involved in neuroscience and particularly your interest in brain tumors?
Thank you, Pat. I'd be glad to. Let me start with my interest in brain tumors. I've been a nurse for 34 years and had wonderful training starting out in my career and just developed an interest in neuroscience. And I'm not exactly sure how I became passionate about brain tumor patients, except that there's so much to learn and there's always a puzzle to solve and somebody to help. And so I think those types of things attracted me to caring for brain tumor patients, is reaching out to people who have these tremendous needs. Patients with brain tumors it's catastrophic for them oftentimes, and it really changes their life completely. And so being able to assist them, answer their questions, make the road a little bit easier was very appealing to me. And that really leads into the mission of the Cullether Brain Tumor Quality of Life Center, is to help people navigate the journey from diagnosis through their treatment and back to living the best quality of life that they can possibly live.
Okay, great. And I know we're going to hear a lot about that tonight. Now, Dr. Alexander, why did you specialize in neurosurgery, and how did you become interested in brain tumors?
Well, I think to echo what Sherry said, I think it started with some very good teachers who got me interested in it. And, you know, with medical education, I think I first kind of fell in love with the science and the anatomy of the nervous system, and as it progressed on to more, my training and my experiences progressed on to more treatment of patients, I sort of became enamored with solving some of the complex problems that treating brain tumors carry with it, especially from the surgical end. And I think it's a constantly evolving field, and one, while very difficult at times, one in which we can do a lot of good and continue to try to make people's lives better.
Well, thanks for sharing your story. Carlos, I wanted to talk a little bit about the Cullether Center. We're going to have a treat for you as well. The Cullether Center actually opened September 24th, 2000, and actually this is their 6th-year anniversary. So we are very excited to share this incredible resource with you and to talk about this during the anniversary. So to really embrace the true meaning of the Cullether Center and what we're going to talk about today, we wanted to show you the essence of really the Cullether Center. So we're going to now cut to a video before we really start a panel discussion so it can kind of pique your interest. So we're going to show you Good Hope. Good help brings hope.
In one instant, everything in life changes. One moment, the worries of the day are bills, kids, school, and work. Then all of that is jolted out of significance by the terrible news. A life is in peril. The news hit Jack Cullether twice. First was his son Chris. In 1991, Chris's future was in front of him. He was motivated, he was smart, and in 14 months after being diagnosed with brain cancer, he was gone.
During that period of time, my daughter, who was graduating from Mary Baldwin College that weekend, instead of going to Atlanta or graduating, she stayed by Chris's side for the whole time, as did my wife. We got an apartment in Durham. And with a lot of help from family and friends, they were basically his caregivers. I would still come back and forth to work. And I didn't understand the importance of a caregiver.
10 years later, Jack learned a hard lesson in caring for a family member dying of brain cancer.
When my wife was diagnosed in 2003, both my daughters were married and they had their families and children, so I became the caregiver. And I saw the pitfalls that you go through as a caregiver. Personality change of my wife. She was the most loving, caring, sweetest lady you ever know. We were married 38 years. But when profanities and screaming and things like this came into play, that wasn't the Gene that I knew. And no one told me. It's because of where the tumor was located.
It may help explain what's going on with Daddy, explain his boo-boo.
That epiphany, the fact that family members enter the brain cancer journey with very little understanding of the daunting tasks they face, inspired Jack Cullether to create this oasis in the midst of heartache, uncertainty, and fear. The Cullether Brain Tumor Quality of Life Center at St. Mary's Hospital.
So your motor strip is kind of right in this area right here.
Okay.
So your tumor is kind of close in to this little spot right here.
Okay.
In the midst of shocking news and emotional turmoil, family members must become medical experts, insurance experts, and fierce advocates for their loved ones. For Drew and Charity Janaszak, that reality hit them with lightning speed.
I was with a friend of mine from JMU on a ski trip at Wintergreen, and was on the second day of a 2-day ski trip and had a seizure going down the slopes and woke up with the ski patrol around me, couldn't figure out what had happened. I couldn't figure out if a skier had ran into me or what had happened, and they rushed me to UVA, and from there on out they did a CT scan and an MRI and found the brain tumor on the CT scan. The CT scan came back abnormal, and then the MRI was the definitive thing that found it.
Drew had brain cancer, and his life was in danger. Yet Drew and Charity soon realized good fortune was on their side. That's because Jack Cullither took the tough lessons he learned from his own family's tragedy and extended a helping hand to Drew, Charity, and many other families facing this frightening and confusing time.
This is Kathy at the Cullither Center.
She spent an hour with me on the phone from my hotel room. It was awesome. So it was definitely a huge boost in support. We definitely felt like we had a light shining in.
Simply enough, the Cullither Brain Tumor Quality of Life Center exists so people like Drew and Charity can find answers, make informed decisions, and have someone to talk to who truly understands.
We brought up an MRI on the computer and looked at it, and she showed me the diagram of the brain and exactly where it was located. And because I think some of those questions you feel like you don't really want to ask the doctors, it's just or the doctor leaves and you've got so many questions that you think you forgot to ask. So I tried to write down as many questions as I could when I was visiting with the doctors, but then they leave and then it's all this other flood of questions comes into my mind.
This is the mission of the Cullither Center, to fill that void that can occur between diagnosis, treatment, and survival. Ultimately, the Cullither program helps brain cancer patients and family members adjust to living the new normal.
The most important thing that I do as an advocate is I try to make the patient's walk a little bit easier. That is the most important thing to me, to help them to be able to get through this, because it's so overwhelming. When you've been diagnosed with a devastating illness, you're so overwhelmed, but life continues to go on, and there's things that have to be done, and you've got to keep moving forward. And if I can make that walk just a little bit easier, that's what I try to do as an advocate.
Good help comes to patients struggling with benign, malignant, and metastatic brain tumors. The Cullither Brain Tumor Center connects patients to a remarkably skilled and caring team of neurosurgeons, oncologists, radiation oncologists, physical and occupational therapists, and nurses. The team now works with the new state-of-the-art Trilogy system, which combines specialized medical imaging with precise and powerful radiation delivery to enable advanced new therapies that shorten treatment times, reduce side effects, and offer new hope for patients previously considered to be untreatable.
He's worried. He thinks the tumor's grown.
Sherry Fox, a nurse who has spent 3 decades caring for brain cancer patients, and Kathy Willis, who lost her husband to cancer, help family members with expert medical advice, assistance in keeping medical records, applying for disability payments, and interpreting the maze of both financial and legal scenarios they face as they try to grapple with the shock of it all.
When families hear that clinical piece and that educational piece, then they also need to hear what it's really been like. And they just love that. They just love being able to get that information about the roller coaster that this disease puts them on.
It just gives them a sense of security. And then we also tell them, come over here to the center and relax a little bit. Get out of the hospital for a few minutes. Come over here and just relax. We'll give you a cup of coffee. We can just sit and we can talk. And that seems to bring them a lot of comfort.
Oh, I think it's extremely helpful, and I think that it's something that they do very well, and they have the resources, and they have the time and the opportunity to spend that with the patient and the family, and I think that's what's needed.
This was true as well for Wayne Hatchell, who began his retirement with big plans, only to have them shattered by a seizure in July of 2007. Wayne quickly learned he had brain cancer.
The hardest thing was the unknown. We did not know what to really expect, and they gave us a resource to give us an idea of what we could expect. And they have provided a wealth of knowledge.
When they say brain tumor, you just think they've given you a death sentence. we weren't going to share this with a lot of people. We were just going to keep it within the family. But you realize you can't do that. You need the support of people. And the Color Center has certainly been our support.
Curtis Harris was a big man, a strong man, and a giving man. Successful in business, he felt it was his obligation to give back to the community.
He was a businessman. That's how I met him. He had a construction company. He was a giver. One of the main things that he was interested in donating money for whatever. Boys and Girls Club, Breast Cancer Society.
Curtis and Lynette learned of the Color Center when Curtis was nearing the end of his brain cancer journey.
And we just need to get her to talk more.
Okay, I think that'll be a good goal.
When he passed away, Lynette saw that his memory and his giving nature could benefit other families going through the same ordeal. So she made a decision.
I couldn't do anything with flowers, so I felt that the money that you would use to purchase flowers, just donate them to the Quality of Life Center. So they continue to provide assistance for people that will come later to learn the information that we didn't have in the beginning.
Lynette was the first to have donations made to the Color Quality of Life Center in lieu of flowers, and certainly not the last. After getting to know Jack Cullither and Sherry Fox, she found the decision was one of the easiest she made during the entire ordeal.
When you find out about the cancer, you really we didn't have anywhere to go to get additional information. So now that this place is here, it is so much better. He would have appreciated what I did. I know he would.
Families in Richmond who are facing this devastating illness are no longer left to find their own answers or create a plan by themselves. They are no longer left without anyone to listen. They are in the hands of the Cullither Brain Tumor Quality of Life Center.
This center has been, I would say, the nucleus of our support. You have to get a lot of stuff off your chest, and Sherry and Kathy were really good about just being that listening ear.
For him to get off the phone and just feel so relieved after talking to her just made a big difference. It just helps to be able to find the answers and find the comfort and, really to just go back to living your life. And, they talk about the new normal and it will never be the same. But for me, it just helps knowing that they'll always be there.
I can't imagine what a family going through this without the Cullither Center.
For a family that's dealt with what we dealt with, to be able to have a place to go to, get information, have the resources there, just to provide information, it's a relief.
It's an incredible blessing to do this kind of work because every day you get an attitude of gratitude when you work with these courageous patients.
For Jack Cullither, the spirit of his loving family will always be a part of this center. It is indeed a place that fits perfectly with the mission of the original sisters of Bon Secours.
It hasn't just been me, it's been numerous friends and donations and the volunteers and the fundraisers that we've had that has enabled this to happen. And primarily because of Bon Secours working with us in St. Mary's Hospital, providing rent-free and help there. So it's been embraced and it kind of fits their mission statement too.
The Cullither Brain Tumor Quality of Life Center at St. Mary's Hospital, offering good help to those in need.
Wow, when I saw that, I was so pleased, and I thought this would really show the essence of what the Cullither Center, and I really want you, Dr. Fox, to say thank you to the families for allowing us to share this with others so that they can know what resources and kind of help with their new normal if this happens to anyone. So, Dr. Fox, I know the Colother Center is a wealth of knowledge with resources, and one of the books we have on the table, we have lots of resources, audience, and this is what you would see at the Colother Center to try to help and teach. But let's try to break it down for our audience. And if you could just tell us just what is a brain tumor, maybe some of the symptoms you may see from it, and talk about some of those signs and symptoms. Like I've heard, you might just have a headache for all brain tumors. So.
Right. Well, a brain tumor is simply a mass of cells that's growing abnormally within the brain, and unfortunately, within the intracranial cavity, there's not much space. So there's not enough room in there to add anything. We have exactly what we're supposed to have within this intracranial vault, and there's very specific amounts. So if tissue starts or cells start to grow quickly or even slowly and takes up space, then we start to have signs and symptoms. So that's basically what a brain tumor is, either benign or malignant. It's an overgrowth of cells. There's a variety of symptoms. There's no particular constellation of symptoms. It's common that people may experience headaches, but not all patients with brain tumors have headaches. Also, another common symptom is people will be going along with their normal life and have a seizure abruptly. And so that can be the presenting symptom of a brain tumor. The other thing that people often notice, and oftentimes it's after they've actually gotten the diagnosis, is that there's been a change in their thinking patterns, a change in their personality. And oftentimes our families, patients and families, don't recognize that at the time. They kind of recognize it looking back and going, oh, I noticed something was different. I noticed a personality change, but I wrote it off to stress, or I wrote it off to somebody aging. Then there can also be focal neurologic deficits that come with a brain tumor. Again, all depending on where in the brain the tumor occurs. The nerves all innervate different parts of the body. So let's say, for instance, you could have a brain tumor deep here in the center, and you might have a weakness in your leg, or a brain tumor over here, and you might have weakness in your arm. So again, it all depends on where the tumor is located, what nerve it's located next to, or what section of the brain it's located next to. How fast it's growing may also clue you in to where the brain tumor is and the type of symptoms that the patient might see. So location, growth rate, and that's probably summarizes it pretty well.
Okay, so let's pick up on that, Dr. Alexander. We've talked about, as Dr. Fox talked about, it can be anywhere in the brain a tumor can. So do you see, as a neurosurgeon, are there particular places in the brain that more tumors occur? And are there areas in the brain that are more dangerous, that you would say, if there was a tumor?
Well, sure. First, generally we break the patient populations down into the adult and pediatric population, and depending on what you're dealing with, what type of disease, that exact age level cutoff varies. But in adults, usually you'll see most brain tumors within the hemispheres of the brain themselves, in an area called the cerebrum, which is the large area here along the dome of the brain. And the tumors can exist, as Dr. Fox said, tumors can exist anywhere in the brain, so it's not just there, but we do see a predilection for tumors to go to the cerebral hemispheres. In younger patients, children, we see more tumors in the cerebellum, which is the back of the brain here, in the lower part, in the back of the brain that's involved in movement and coordination. That's a very common area, and one of the most common for pediatric brain tumors. Additionally, when we see metastatic brain tumors, something else we see an awful lot of, that's tumors that are from somewhere else in the body but go to the brain, such as lung cancer, melanoma, things like that. They tend to have a predilection for the cerebellum, but basically you can have a tumor anywhere, and where the tumor is will dictate how you present, what types of symptoms you have, and then also will guide at times what the best treatment is, how aggressive we can be surgically, what kind of role radiation will play in it, and so on and so forth. So it can be anywhere, and it's certainly not unlike real estate. Location is an important factor in brain tumors.
Okay. So Dr. Fox, can you, I know there are particular tests that we'll do after we think that they've shown those signs and symptoms. Can you describe some of those tests that we do for those diagnostics to rule in brain tumors or rule out? And is surgery play into that, any of those diagnostics?
Certainly, and please, Dr. Alexander, please join me in the answers to these. Probably the most common test currently is the CT scan.
Okay.
The CT scan is able to show masses. One can tell the size, the location, whether it's got blood in it. They can often differentiate the malignancy, not exactly accurately, but they can tell a little bit about the level of malignancy of the brain tumor. So CT scan is the most common diagnostic tool. Beyond CT scan, MRI can be used. It's more used in treatment planning and evaluation of the therapies as opposed to diagnosis, but it's certainly an important part of the diagnostic workup and is often used to plan the surgical procedure with more precision. And if I don't know if Dr. Alexander would like to expand on
that.
Sure,
I agree. Now, CAT scan is generally the first treatment or the first diagnostic study, that will be done to screen somebody. Oftentimes it's done in the emergency room or when somebody's presented with a seizure or an event like that. And it's a very relatively easy and quick way to differentiate between brain tumor, stroke, blood clots, things like that. It's not always that as specific as, say, an MRI. So usually once the information with a CT is performed, where you have the information that there's something there and we're worried about a brain tumor, we'll move on to an MRI, which will be a little more specific and sensitive to look at the brain tissue itself, the location. Also, based on the way that the tumor looks on the film, you can get a general sense and oftentimes get a general sense of what type of tumor it is. So while we can't tell for sure, we can never hang our hat on a picture and say it's 100%. Oftentimes, based on the appearance of a film, appearance of a tumor on imaging studies, we can make an educated guess as to what type of tumor it is, whether it's something that's looks very aggressive or looks relatively benign. But again, that usually has to be sorted out with tissue.
So,
if I could just add one more piece, I think the most important diagnostic tool is the biopsy that's done by the neurosurgeon. And so it's sort of expanding on what Dr. Alexander said. We can look at the films and have some idea, and we can think about age and the occurrence rate in those age ranges, but it really is the biopsy done by the neurosurgeon that gives us the definitive diagnosis.
So that's exactly what I was just going to get into. You all transition well, and I'll just sit here and you can all do well all day. So I know that you had talked to me today, Dr. Fox. I had read that it was 120 types of brain tumors, and you said, no, they're now 126. So I wanted to talk about that a little bit more, the biopsy and the staging, just so that we can get familiar with some of the terms that you all know. What does that mean? How, are there more common types of brain tumors than others? And then Dr. Alexander, if you want to talk about staging and the biopsy procedure, and when do you get involved? Who brings you in, and how does that happen? How do you get referred, or is it through, I know there's oncologists, is it through Dr. Fox, or how do you get brought into for neurosurgery?
Well, I think whenever there's a brain tumor is identified, whether it's in wherever the point of entry is, whether it's by your primary care doctor or ordering a study, whether it's by an emergency room treating a seizure, or whether it's by another specialist, a neurologist, Dr. Fox, we're usually involved. And that's when we get involved. And we're involved in the decision-making process, seeing the patient. Oftentimes, the biopsy is the necessary step prior to an open surgery. Now, again, as Dr. Fox alluded to, you can make a good educated guess on what a tumor is based on its size and location. But oftentimes for tumors that are within the brain tissue itself, we can't tell for sure how aggressive they are, what type of grade. grading, to say what grade it is, really refers to how aggressive they are. And so when we grade tumors, no matter where in the body, we're grading tumors, usually the higher number, the higher the grade, and the more aggressive the tumor is. So based on that, we'll recommend further treatment. Now there's, the first step is the biopsy. Sometimes based on the location of the tumor, if it's in what we would call eloquent brain or somewhere where it's very sensitive or a deep part of the brain, we'll go and recommend a needle biopsy, which we use specialized equipment and essentially pass a needle through the skull and take a piece of it to get a diagnosis. Once we have that, we can decide on further treatment. Sometimes we forego the needle biopsy and do an open surgery if the tumor is readily accessible, or if there's something causing what we call mass effect, that the tumor's large, causing pressure, and needs to be at least partially debulked or some of it taken out. We'll forego a needle biopsy. I know that answered just some of the questions.
No, that was good. That was good. And at callers, it is between 6:30 and 6:45. So if you want to call in, please call us at 804-915-5202. Yes.
I was just going to add to Dr. Alexander's comments. One of the things I've learned in my many years of doing this is that brain tumors, brain cancer, and the diagnosis of brain cancer is often more complex than perhaps other cancers. And I don't know if you would concur with this, Dr. Alexander, but there's so many different types of tissue in the brain and cells. And oftentimes when we get a biopsy, it will sometimes come back as not quite sure, and so we have to delve into some more diagnostics, perhaps another opinion on the biopsy. And I try to talk to patients and families about that because it's confusing. You know, why can't you just tell what it is with that one piece of tissue? But the brain is magnificently made and has so many different types of cells that it often makes diagnosis complex. So that's something really important for patients and families to understand.
You brought up something about a second opinion, then I'm going to get in treatment because I know that a lot of people. What about a second opinion? What do you tell families about that?
I typically always recommend a second opinion. I believe that it helps patients and families feel like they are moving in the right direction. You know, we are very blessed in Richmond to have absolutely fantastic health care, and I absolutely trust our neurosurgeons and the people in this community. So it isn't about a lack of trust, but particularly when involving very complex brain tumors in, as Dr. Alexander mentioned, eloquent locations, very large tumors, very rare or unusual tumors. I really encourage families to get second opinions, and it's been my experience working with Dr. Alexander and other wonderful neurosurgeons in the community that they also encourage families to do it because it builds confidence. It helps the patient and the family feel like that they've gotten all the information on which to build their decision.
Okay. When do you get brought in, Dr. Fox? How does somebody know about the Colother Center? I come to the ED and you know, unfortunately, you might get diagnosed with the brain. How do we know about you?
Okay. Well, there's a variety of ways that patients come to us. One of the main way is that at St. Mary's Hospital, I reach out on the floor to the nurses and staff. They know that I'm there, and we find out who's there, and we go to visit and tell them about our services. The neurosurgeons are wonderful about referring to me. Although that's not required, they know the value of the Colother services, and so they often will contact me and say, hey, I've got this patient that I need you to see. After 6 years, more and more we're getting referrals by word of mouth. Oh, you've got to go to the Colother Center. So there's, those are probably the three most common ways that people find out about us.
Dr. Alexander, now that person has been diagnosed with a brain tumor. Let's talk treatment. And I know there's a wide, again, it's an hour, 35-minute show now, but I want to try to get in as much treatment talk as possible. And Dr. Fox, please chime in. Radiation, chemotherapy. We saw something in the video about trilogy. This is really not my world, which is why you all are here. So if you could please just enlighten us on that, the recommendation of why you go which way. And
okay. Usually the first treatment is surgery. first line of treatment, whether it's just a straight needle biopsy if it's a tumor in an area that's not very safe to operate, or an open craniotomy, which is the formal operation, formal term for going into the skull and removing the tumor. Once that's done, that establishes the diagnosis, and then treatment really depends on, like we were saying, the multitude of different types of brain tumors. But to simplify it, it often depends on, is this malignant or benign? And those terms are also that the lines are a little bit gray, especially in the brain. Different types of cancers have a clear line between malignant and benign, and a lot of times in brain tumors there isn't that clear line, so some are in between. But generally, if the tumor is aggressive or different types of tumors, we will then usually refer patients for radiation treatment and radiotherapy. And there are different types of radiation treatment. Trilogy is one of the ones that's out there that's an exceptional means of treating lesions in the brain. It's a very precise and focused, essentially a precision instrument to get radiation effectively to an area of the brain that needs it and not injure other structures, and that's the name of the game. So oftentimes, especially with any type of glioma or intrinsic brain tumor that's aggressive or malignant, radiation is going to be a very important part of the treatment. Along with that, we use chemotherapy. A medical oncologist will get involved in chemotherapy. Is used in conjunction with radiation treatment. Chemotherapy, over the years, the results have been mixed for brain tumors because the brain has certain protective mechanisms that keep it from getting all the bad stuff that the liver and the gut get, but it also unfortunately has been kept some of the chemotherapies out of the central nervous system and not so they've not been as effective. But nowadays there's a lot of developments and new science out there with chemotherapy. So chemotherapy is a standard of treatment with malignant brain tumors and effectively works with radiation therapy. And there are also a lot of newer treatments out there in the chemotherapeutic community with neuro-oncologists that are helpful.
Dr. Fox, can you tell us a little bit more about the treatment? Like where are they? Where it can be done? Infusion centers. What and side effects and.
Of course, surgery. Obviously is done in the operating room for the most part, and so that one's pretty easy. Radiation therapy, usually you can either have radiation therapy in the hospital setting, and sometimes there are outpatient centers that have radiation therapy as well. Chemotherapy, interestingly, in brain tumors, the first line of treatment with chemotherapy is an oral chemotherapy agent, which is a little bit unusual in terms of other types of, or comparing it to other types of cancers. So you can actually get your radiation treatment and take your chemotherapy at home and not have to come into an infusion center. However, if that treatment is not effective, then there are other types of chemotherapy that are injected, and you would need to come into an outpatient infusion center. You can also have chemotherapy done within the inpatient setting, but that's a little bit unusual.
Okay. Side effects and secrets to side effects. I did come into the Cullither Center, Pearls. There were some things you had on nutrition, and that's one of the things that
my experience when working with patients over the years, as they go through, even with the experience of the brain tumor, and then with treatment, and then even beyond treatment, there's two very common side effects, and the biggest one is fatigue. Patients feel exhausted, particularly if the tumor is malignant, because those cells are dividing very rapidly, and that changes the body's, I guess, metabolism, for the lack of a better way to say it. And so that cell division causes extreme fatigue. Then you add on top of that a very powerful radiation, and then chemotherapy, which the purpose is to kill the cells, so it's damaging cells. Cells are dying, and so that zaps the patient's energy. So fatigue is one of the most common problems that we see. The other common problem that we see is just changes in mentation, again, recovery from brain surgery. It takes a while to get over the effects of anesthesia. And then again, the fatigue contributes to mentation and the ability to think clearly. So those are two very common symptoms. Obviously, with all cancers, including brain cancer, nausea and vomiting can be a problem, although nowadays we have such fantastic medications to treat nausea and vomiting that if patients are put on the appropriate regime and they take it appropriately, that can almost completely be avoided.
Dr. Alexander, what can the families expect with surgery? Is it a short surgery, long surgery? Does it vary?
Yeah, it's a good question, and it's something that's very hard. It's each individual case and each individual surgery is unique. Brain surgeries for tumors can be quite lengthy, quite extensive. They're delicate surgeries. They require a lot of time, a lot of meticulous work, and sometimes some specialized instruments. So the time can be a factor in these surgeries. Some surgeries are much shorter. If the tumor is very accessible, we do this a lot, and we can get there and take care of it pretty quickly. Obviously, if we can limit the patient's time under anesthesia and on the table, that's the best case scenario. One thing I will say too is brain surgery is not painful, not terribly painful, which is one of the good things. If I can ever shed some light on somebody undergoing a brain tumor surgery, is it's because the brain tissue does not have sensory fibers, and really where you get a lot of pain from surgery is muscles, which you don't usually have to dissect through a lot of that in these types of surgeries. Patients usually do pretty well in terms of recovery from a pain standpoint. So barring any neurologic complication, patients will do fairly well with brain surgery, surprisingly well in terms of the lack of pain and their ability to get up and move and feel okay afterwards. But as Dr. Fox said, there's a lot of play with regard to the length of surgery, and of course if there's any neurologic changes before or after surgery, that becomes very challenging to deal with around surgery.
So the post-surgical, they usually go to the intensive care?
Yeah, they usually go to, after surgery, most patients will go to the intensive care at least for one night, then to a specialized unit. For instance, at St. Mary's Hospital, we have a dedicated neuroscience unit, neuroscience telemetry, and they usually be there for a few days or as long as it takes. Oftentimes afterwards, people will need inpatient rehabilitation, which to stabilize, to get their strength back. So there's it's a spectrum of care, starting with the most acute and the most intensive, down to a more gradual step towards getting home and getting back to your life.
Great. So when I first reviewed the DVD and the website on the Colother Center, I think what made it really extraordinarily special was the numerous resources that you had. I heard about social work, helping me with funding, really getting back to my life. I also heard about the nurse navigator. So it's a very teamed approach. The physicians are involved. Rehab, as you had just talked about, was very involved. How is all this sustained, and are there support groups? And just tell me how, so in case any listeners want to know how they can help or donate, we would love to know that. And the center's operation and all of that, that would be great.
We are sustained, first of all, through Bon Secours and Bon Secours' generosity. Bon Secours took a big risk when they brought the Colother Center on back 6 years ago, because there's no other service like it anywhere. It's very unusual. There's nothing like it locally, and there's nothing like it nationally. So Bon Secours has been very generous in supporting some salaries, supporting some of the purchase of materials, purchase of models and things like this. So Bon Secours has been fantastic, and the Colother Center really displays the mission of Bon Secours to good help in the community. So that's number one. The second way is we have had large generous donations, particularly from Mr. Colother, who was able to establish the beautiful setting that we have. And then we have many of his friends, and as well as himself, who continue to support us financially. In addition to that, we have several fundraisers a year, which is wonderful in terms of raising funds, but it's also wonderful because we engage our patients and our families in those. So it's a type of social support, which is also very important. And then the other way that we're supported is through memorial donations. Many of our families donate memorial funds to us, and so that's helps sustain us day in and day out.
And I wanted people to know announcements, because this is the community, the Central Virginia Celtic Festival and Highland Games, which is October 20th and 21st from 9 a.m. to 6 p.m. at the Richmond Raceway Complex. So this is a fundraiser indeed for that, and that's fabulous to have that. And I'm gonna get all my announcements in. Their survivorship journey. You want to talk about that, Dr. Fox?
Yes, the survivorship journey is a workshop that we're putting on November the 3rd, and it's focused on all types of patients with all types of cancers, and it's for patients and caregivers, and there'll be a variety of lectures throughout the day, throughout the course of the day on November 3rd, trying to help patients and families live better, live the new normal, improve their quality of life with their disease.
Okay, so now here's another flip that I'm gonna go to both of you all on. Prevention. You know, we talk about, is there any prevention for brain tumors as there are for other cancers? You know, people want to hear it. So is it, and if there, I mean, we're watching and we want to know, is there anything for prevention that can be done? And maybe talk about early detection. I mean, that all along the lines, just to have a better brain health.
Would you like to address that, Dr. Alexander?
That's a tough one.
Right
now, someone years ago, one of my mentors told me that bad problems tend to happen to good people, so don't be too nice. But that, I mean, the point there was, for brain tumors especially, there are a few things, but by and large, we don't really know where they come from or what the major risk factors are. Unlike lung cancer or some of the other cancers we see, we really haven't nailed down anything. So far, the data on cell phones is out. So far, the data on you know, we know that in lab rats if they really eat a lot of NutraSweet, but otherwise, it's really, there's nothing been shown that we know. So it tends to be a sporadic event, meaning it's just a random problem that occurs. And so in terms of prevention, we really don't you know, have much other than general health prevention, leading, you know, a healthy life, exercise, and diet. In terms of early screening, there have been some moves in certain parts of the country and the world to screen people with MRIs and things of that nature, but again, really, it's not until people develop symptoms that they go for that type of specialized diagnosis, CAT scan or an MRI of the head. Obviously, if there's a significant family history and a tumor that tends to run in families, then they should be screened. But otherwise, it tends to be something that there's not really a good early detection or an obvious avoidance maneuver that's been shown to help.
I think it's important also for people to know that brain tumors, although it certainly doesn't feel this way to me sometimes because of what I do, but brain tumors are rare compared to other types of cancers, only about 2% of all cancers. So rarely, when people develop headaches or maybe some of the things that symptoms that you might worry about being related to a headache, it's rarely ever a brain tumor. It's really the last thing you think about, not the first thing you think about. So that might be helpful for people to know.
Okay. We have about 10 minutes, so I wanted to know, let me go back to something you said though, metastatic. Are there more places that have metastatic to the brain than others? If you all could talk about that, that would be good before I lose that thought, and then we can go to the...
Breast and lung are the two most common sources of metastatic brain cancer, but it can metastasize actually from any source. but lung and breast are the most common. Another common one is stage 4 melanoma.
Yeah, there's breast and lung, by virtue of the fact that they're the most common cancers in general. Again, melanoma is an important one that we do see go to the brain very frequently. It likes to go to brain tissue. Kidney cancer as well, renal cell carcinoma, likes to go to the brain as its first stop. So those are two. Thyroid can go to the brain as well. I think as people have lived longer and done better with their systemic cancers, we've seen more and more brain metastasis from organs that typically did not go to the brain. We'll see it from the colon cancers. We'll see it from the genital urinary cancers that were very uncommon years ago because people didn't survive that long with the primary disease. And as in medicine, we become more successful at treating these people, these patients. We're seeing it go to the brain.
Dr. Fox, do you want to give the number to the Colother Center in case anybody wants to call? I meant to ask that.
Absolutely. The number for the Colother Center is 804-287-7809. And if you're interested in learning more about us, learning a little bit about how we came to be formed and those kinds of things and some of our resources, you can go online to www.braintumorqol.org.
So, I have to have cues for myself as well. And one of the reasons I wore pink today was because October is Breast Cancer Awareness Month. And as we were talking about, that's a place where the brain tumor may metastasize from that. Please go out and get your mammograms. I got mine done before the rush this week. And so I want to say in a prevention mode, those are some of the things that you can think about doing. We have about 7 minutes left, so I'm going to ask you all to split and do a teachable moment of what you really would like the community to know. Because even in the video, it was nice when you heard the young man saying, you have so much that you want to ask and you just don't know where to ask or where to process. So kind of your teachable moment that you think is really important for the audience to remember from today. I know if you want to share that book was phenomenal, or any of your pearls of wisdom for anything. I know Dr. Alexander, if you want to talk about your services and talk about that, where they're located, feel free, that'd be great.
Well, I think for the Colother Center, the most important thing to know about the Colother Brain Tumor Quality of Life Center is that we are there for patients and families, and we serve anybody, anywhere. I have patients from all over the country who find out about us and call for information, support, guidance, etc. So we are free of charge, which is something that is very uncommon. We do not take insurance. We don't bill insurance. If you go to a competing hospital for your health care for your brain tumor, that's okay with us. We want to serve you anyway because this is such a catastrophic illness, or can be, and we have the resources and the time to help you. We work very collaboratively with our physicians, but what we have that our physicians often don't have the time to do is to sit down and answer a lot of the anticipatory guidance kinds of things that you need to know, like what could happen next? What should I think about in this scenario? What should I plan for? And those are oftentimes those difficult questions that you forget to ask when you're at the doctor's office. The doctor really doesn't have time for those kinds of questions. So we have the time, the resources, the support. There's almost no issue or question that we won't tackle. We can provide resources for legal information. And so many of these patients have legal issues in terms of maybe needing a will or disability or whatever it might be. We have financial resources for people who are struggling, maybe to get their meds or transportation, etc. So don't go this alone. If you have a brain tumor, reach out to us. We'll do everything we can to make the journey an easier road for you.
Thank you. Dr. Alexander?
Yeah, I agree with what's been said. I mean, I think to echo what Pat Sherry have said, you know, this is a very difficult problem and often a very difficult disease. I think in this community we have a lot of people who really care and are doing state-of-the-art work and really trying hard to fight this disease and help people get through it. A lot of it depends on what type of brain tumor it is, but it's not a death sentence. It's not always a death sentence. And I think that you know, to find a physician and a care group that has skill, compassion, and is willing to go down fighting with you is a very important aspect in treating this disease. And I think we're fortunate enough to have that here. So, you know, we're here at Neurosurgical Associates and myself, we're here to help in any way we can.
And I'm so glad you said that, because a lot of people do think that. They think it is a death sentence, and they don't know where to go or where to turn. And so I'm glad that we have that capability to be able to do that. I want to just also give out a couple of more announcements. Now, this is our second show of our Neuroscience series, and we have 4 more shows that we will be doing. Next week will be on minimally invasive spine, so that's a hot topic that I know people would love to talk about. Then the week after that is October the 10th, and we will be doing a series on stroke risk factors. The 17th, we will be doing it on the treatment of stroke, and so there'll be very different things that we'll talk about. We'll go from the risk factors to the clot buster to some endovascular treatments that we'll be doing. And then the last week of our series will be on epilepsy, and we'll talk about some of that treatment as well and how you can detect seizures. I did bring also the Full Circle Supporting Quality of Life. It's Good Education, which is also at St. Mary's. And last night, doggone it, I missed it. They had a massage, learn techniques that you could use at home. And these are also free educational sessions, and they are always the 4th Tuesday of the month from 2:30 to 3:30. So next week, they're doing Being Safe and Strong, not next week, October 23rd, Being Safe and Strong at Home, and November the 27th, they're doing Managing Holiday Stress. So I will tell you that I know is a stressful thing during that time, so we want to make sure that we do tidbits for that. I also want to just again say thank you again to those family members in the video, because without sharing your story or your experiences, your testimonials, we couldn't do this without you, and we're here. That's exactly why we're here. We're here to care for you and to serve and to keep those families upheld and to have their hope in starting their new life. I certainly am glad again that we have this panel here, and I know that at the Colother Center, if you would like to get in touch with them, we can certainly make that happen. You can go to our website, www.bondsecours.com, or again, you can call us at 359-WELL. I certainly have I love your saying, an attitude of gratitude for you all joining us this evening to share the special neuroscience perspective on brain tumors and the Colother Brain Tumor Quality of Life Center. As you heard, it is very special. There's nothing like it in the world, in the United States. So certainly while you're in Richmond, you want to be able to take part of that. Until next week, have a safe Neuro Week, and we are glad that you joined us, and we'll see you next week for Minimally Invasive Spine.